course, yesterday was Mother's Day. This week is National Women's Health Week. So as we continue celebrating moms and the women in our lives, we're focusing on planning for a healthy pregnancy. Certified nurse midwife Fran Cresenzo-Dishmon with Cone Health Center for Women's Healthcare at Family Tree. She's joining us with what you need to know for a healthy pregnancy. Let's start at the beginning. Let's say someone is thinking about getting pregnant. Should they go to the doctor before they get pregnant or after they get a positive pregnancy test?
So, ideally, you should connect with your provider before you get pregnant. And we refer to this as the preconception visit. And this visit gives you the opportunity to do things like review your medical history, check your medications for safety during pregnancy, discuss and manage your chronic health conditions like high blood pressure, diabetes, check your vaccination status, and just gives you an opportunity to discuss your overall health goals with your provider. We all know the earliest weeks are the most critical for fetal development, and so preparing ahead of time can really make a difference.
All right, so with that said, what important things are there to do before you get pregnant as you're beginning your pregnancy journey?
So, the biggest priority would be to optimize your health before conception. So, this includes things such as scheduling that preconception visit, starting a prenatal vitamin with folic acid, again, reviewing your medications for safety and making adjustments as needed. Make sure that your vaccines are updated. Some of them you cannot get while you're pregnant. Of course, you want to focus on healthy habits such as balanced nutrition, regular exercise, sleep, and stress management.
Okay, so you did mention folic acid there. You hear that a lot. Are you taking your prenatal pills? When should women start taking that, and why does it matter what the timing is?
So, almost all prenatal vitamins have folic acid in them. The amount that you want is 400 micrograms, and you ideally would start taking them about 1 month before you conceive. A lot of experts recommend any woman of reproductive age that could possibly get pregnant just to get in the habit of taking a prenatal vitamin. And that way you'll have it on board before you conceive. And the reason the timing matters is because taking it early can help reduce your chance of having neural tube defects, which affect the baby's brain and the baby's spine. And all these things are forming in the earliest weeks of pregnancy, and a lot of times before you've even missed your period. And so, taking that folic acid before conception can help prevent those birth defects.
Okay, let's talk about the birth weight. And I'm talking about weight like before and during pregnancy. How does that impact mom, impact baby? What is the best and most healthy approach?
So, weight can impact fertility and pregnancy complications and delivery outcomes. If you are significantly underweight or overweight, that can affect ovulation, pregnancy risks such as hypertension and diabetes, preeclampsia, C section. I want to stress that the goal is not perfection. Like, we don't want you crash dieting, try to lose 20 pounds just so that the scale looks good when you get pregnant. The goal would be to have sustainable, healthy lifestyle choices such as nutritious eating and physical activity. As far as weight gain during pregnancy, that depends on your starting BMI, body mass index. And so we may recommend you gain as little as 8 to 10 pounds, or we may recommend as much as 35 to 40 pounds, which these are, of course, the kinds of things you would discuss with your provider early on in pregnancy.
Gotcha. And you want to talk about it instead of just be surprised by whatever it is happening in those 9 months. So, what about
Yes.
lifestyle habits? And this is stuff that is like long before you're getting pregnant. I'm talking about marijuana use, smoking, alcohol, vaping. What should women and their partners
Mhm.
know before they get pregnant?
So, if you're trying to conceive, it's just best to avoid those substances: alcohol, marijuana, tobacco, and vaping. They can all affect your fertility. They can increase your pregnancy risk, and they can potentially affect fetal development. There is no known safe amount of alcohol during pregnancy, and marijuana may seem harmless, but we are gathering evidence showing that it could affect fetal brain development. So it's just best to avoid all of those things if you can. Now, I would also stress at your preconception visit that if you need help reducing your use of these substances, let your provider know so we can help get you some support to achieve that goal.
Right, because there's no sense in going cold turkey and having all the hormones and everything else happening at one time. I mean, you need to have a
Yes,
plan for that. That's a lot of stuff happening in your body.
agreed, agreed.
All right, we're going to continue this conversation. We're going to be back in just a few minutes.